If a patient who's pregnant discloses to me that she has a substance use issue, first of all, I say, thank you for telling me. I'm sure that was difficult. We don't really do a really nice job of addressing this issue in traditional healthcare. I remember they're coming to the doctor, right? They're coming to the provider's office. If somebody's coming in and they're pregnant, they're gonna have certain things they're gonna be expected to talk about. And there might be some things that they come in that they might not be ready to talk about. So don't apologize for bringing up questions that are relevant to a person's health and well-being. Sometimes providers confuse their role as healthcare providers and police. As physicians, as nurse practitioners, as PAs, our role is to be a patient advocate and to develop a therapeutic, positive relationship with our patients to help them thrive and flourish. That might sound overly optimistic, but that's it. They're here to promote health. We are not here to punish. We are not here to apply laws or what we think are regulations. Again, that might sound overly simplistic, but that's essentially what it is. What we're here is to help people be as healthy as they want to be, help them identify their health goals, and help them get there. That's what patient-centered care is. Our goals should be what our patients want in terms of thriving and flourishing. They're at the center of the treatment plan, of the decision-making process. Sometimes we think we're helping when we bring in other questions or other lenses into the discussion, but if we keep our patient and their patient desires and our patient's health at the center, it keeps us on the right track. When we talk about working with pregnant folks with substance use disorders, our goal should be, how do we help our patients be as healthy as they can be at any given moment? We can't expect necessarily somebody to walk into treatment and say, hey, I'm pregnant, I need my prenatal care, but I also have problems with a couple different drugs. Okay? If that happens, phenomenal, but sometimes it doesn't. The most important part of a primary care or maternal health visit is the second appointment, keeping them coming back in the door. Because if we keep pregnant people coming back for treatment, that means that we're developing a relationship, we're having a conversation, we're able to define and refine what our treatment goals are. Once patients get to know you, they're more likely to trust you, they're more likely to give you the information you need to be the most effective healthcare provider that you are. What benefit are you getting from using this substance? Have you thought about cutting down a little bit? Let's talk about the effects this substance may have on the health, not just of your baby, but on you as well. And let's see about ideas about maybe cutting down a little bit. Are you open to having that kind of conversation? And then if you are open to that, let's talk about some practical ways to dial down use a little bit. What works for you? What sounds attractive? We want people to enjoy this relationship with their treatment team. We want people to be comfortable asking questions. We want people to find ways that are attractive towards moving towards health.